Today I'm going to explain a little bit about how it would be the best approach in your home environment to look after your feet on a day-to-day basis. For anyone, all of these tips can apply. The first thing we look at when we're looking at someone's feet is we're looking at the color of the skin. We're looking for changes in coloration, when the foot is in the down position, whether there's redness or paleness. The other thing I'm going to be looking at is whether the person, or I will ask the person, if they are able to grow hair in their lower legs. The other area I'm going to be checking, and the person can do at home as well, is whether there's any swelling around the ankle region, the upper portion of the lower leg, or within the foot itself, whether there is swelling. We're going to look for any breaks or cracks in the skin. The way we would treat the fissures and callus on the foot is to recommend regular moisturization. Oftentimes a non-perfumed type of moisturizer would be recommended. It depends. Some people have sensitive skin, and so you'll have to use the product that works best for you. Following your shower and drying your feet completely, for those individuals with a chronic underlying condition, we usually recommend that you take a mirror, just a dollar store mirror that enables you to look at the bottom of your foot if you do not have the flexibility to bring your foot up to look at the bottom of your foot. So when the skin is within 10 minutes of your shower, just a gentle upward stroke with the pumice stone or a file would be appropriate. People sometimes have a sawing motion going back and forth. We do not recommend that. That causes little microscopic tears, which can again lead to a possible infection. We're not recommending that people go and use the solutions that you can purchase at a drugstore. Oftentimes there's chemicals that can eat into the skin of the foot and cause serious wounds. I also look to see if the toes are overlapping, if there's any pressure. Calluses are usually caused because of pressure, and usually that can be corrected by appropriate footwear. For nail care, we're actually recommending just filing the toenails in the same direction. Everybody has a different preference. Generally speaking, a gentle moon shape. Some people are prone to ingrown toenails, and so just doing a gentle filing of the toenail at least once or twice a week will help protect you from getting that ingrown toenail. Now, people that have chronic disease or any change in their circulation, we do not recommend that they go to a commercial pedicure or manicure place. That can be very problematic. Just because we don't know all the time if their equipment is sterilized appropriately. So we usually try to recommend you towards people like the Victoria Order of Nurses for a safer professional medical foot care. How often should you do that? Each person varies. The adult toenails grow a little bit slower in the winter as compared to the summer. Most people can do well with professional foot care if that's required about once every 2 to 3 months. Prior to doing foot care, we recommend just warm tap water, not hot. We usually use vinegar as a antibacterial kind of agent. You can just pour about 3 tablespoons of vinegar into a basin. Soak your feet no longer than 10 minutes. We really don't want you to cause over moisturization of the feet by soaking your feet for too long, and that can occur if you do it for longer than 10 minutes. And those would be my main tips.